This episode is going to be for parents. Maybe you've noticed a change in your teen's behavior. Maybe you have this gut feeling that something is off, but you're not really sure what to do about it. It can be so difficult to understand the difference between what is normal teen development and what is actually something to look out for, which is exactly what we're going to talk about in this episode. My name is Caitlin Gilner. I'm your host. I'm a master's of social work grad student, and I'm a soon to be therapist. And I had the pleasure of interviewing Dr. Jessica Rabon. She's a psychologist, and she works with teens and adolescents. This is what she does every single day. And she helps us discover why it's so important to trust your gut feeling and also how to have the conversation with your teen if you feel like something is off. We're also going to talk about different resources for both you and for your teenager if you have suspicions that they may be depressed or if they are experiencing any sort of mental health concerns. One thing that really stood out to me was that I used to volunteer for the crisis text line 9888. And one thing that I noticed was that so many teens were constantly reaching out and they were having thoughts of themselves and others. And they were having these thoughts off of things as little as not passing a test, not fitting in socially. And some of the signs that should be looked out for could also just be passed off as normal teen behavior. And the people who were texting into this text line weren't 15, 16, 17-year-olds. I'm talking 12, 13, and 14-year-olds as well. So if you're a parent, and this is something that you're interested in, you're definitely going to want to stay tuned to this next episode. I also have a freebie, which will help you kind of decide what's anxiety and what's an actual red flag through using dialectical behavioral therapy. If that's something that you're interested in, you can find it in the link to my link tree, or you can drop a comment below and I will go ahead and send it to you. But without further ado, let's dive into this next episode. I hope that you enjoy. When should a parent trust their gut that something feels off?
I'm a huge trust your gut person in general. And so I feel like if a parent's like, ugh, something just feels off or different, lean into that. Like, just approach your teen and just be like, hey, I am feeling like something's off within our relationship or dynamic or whatever it is. What I tell parents a lot too is if you feel like something is off and you notice a change in your teen's behavior, whatever that change may be, and we can get into that when we talk about like
Yeah.
signs of depression, identify that change when bringing it up. Say like, hey, I have this feeling something's wrong and I noticed X. So I noticed that you are more irritable, or I noticed that you've been in your room more. Is something going on that we can talk about? Because the last thing you want to do as a parent is ignore that gut reaction and it be something bad. I mean, I would argue that if you have that gut reaction and your teen's like, no, I just like had a really bad night's sleep. Like, mom, I'm fine. At least you checked in and
Right.
like you didn't miss something. So I would tell parents if you have, I don't know, a gut feeling that something's off, check in. But if there's behaviors that you've noticed that kind of
Yeah.
indicate that there might be something off, bring those up in
Yeah.
combination with your gut feeling.
So it sounds like anything that's kind of just like different than their normal behavior, like any sort of change.
Yes. So I tell parents all the time because they're like, how did I miss the signs? Or how would I know if my teen is depressed or anxious or whatever it might be? And what I tell parents is look for a change in behavior. And I know that's very broad because what does that mean? For a lot of teens, you would see this change in behavior at school first. So, like declining grades or school avoidance or not doing homework or doing their homework and not turning it in. But it could even be things like change in sleep habits, change in like irritability. But if you're noticing like a pretty abrupt change, that's usually a sign that there's something going on. It doesn't have to be a mental health concern, but usually it's a sign that there's something that you should check in on.
Yeah. And you mentioned like peer influences and stuff like that. What are some other like common trends that teens are coming to therapy for right now?
Um, so academic pressure and like anxiety related to academics. This is probably the world I'm living in, but we see a lot of eating disorders. There's been a significant rise in eating disorders in teens since the pandemic. You have like the standard depression and anxiety. I'm also seeing a lot of like physiological, and once again, this might be because of me working in a hospital, but like physiological manifestation of mental health concerns. So whether that is like chronic abdominal pain or migraines, or I don't know if you've heard of psychogenic non-epileptic seizures, but basically for listeners who may not be familiar, your stress or anxiety is so high it causes your body to respond as if it's having seizure-like activity. So I see a lot of like physical manifestations of stress and anxiety as well.
Wow. Yeah, that's really important to touch on. And I mean, not to go off on too much of a tangent, but I am
No, this
curious
is fine.
about like how like COVID has impacted a lot of people's bodies, right? So I'm curious how that has changed things. And also just like we live in such an interesting time where a lot of teens weren't in school for a long time. They were isolated, then they were
Mhm.
back in. And so, yeah.
Yeah, well, I think you just hit the nail on the head by saying isolated. So that's one thing I've seen a lot, that people are still not really over the isolation they experienced during COVID. Because if you think about it, so COVID hit in 2020, so 6 years ago. And so if you're thinking of older teens, like 17, 18-year-olds, they were 11 and 12. So late elementary, early middle school. The younger teens were early elementary school, so you have missing out on that foundational, like, socialization at school, even just, like, academics being harder for a lot of individuals because they missed out on that foundational learning. I mean, you can argue, yes, they did e-learning, but it's different, right? And so then you have anxiety, you have academic pressures, you have questioning their intellect, self-worth. With regard to body image specifically, what I saw shortly after the pandemic was a lot of particularly teenage girls were like, I'm at home, I'm isolated. What can I do? Well, I can control how much I exercise. I can control not eating. And then obviously that continued. And then you also have like social media. I think we haven't really gotten back to where we were before the pandemic with regard to like social connection. So, yeah, people are back in school, but we're also primarily engaging with people online. So we're looking at pictures, like prom season just happened where I live. And so, you're just looking at pictures of people you go to high school with, or maybe people you don't even know, and comparing. So I think there's a lot of impacts of the pandemic, which could be a whole episode
Oh,
within
yeah.
itself.
It's so much that we did not have to deal with and their parents didn't
Mhm.
have to deal with. So,
Yeah.
it's quite interesting, especially when you say that. It's like parents generally have good intentions, they just don't, like, know exactly how to approach them. So, let's go ahead and get into it. Let's talk about the 5 signs that every parent
Mhm.
should be looking out for, or if they notice any of these signs in their teen that it might be cause for some concern, or it may lead to, them being a little bit depressed.
Mhm. So, I mean, I guess this is not a sign within itself, but going back to what I already said, like, I think the number one thing you wanna look for is a change in behavior. What that looks like for your teen is gonna be different depending on the teen, but if there is an abrupt change in behavior, and to clarify, like, a more negative change, but common signs that I see that parents often overlook, whether it's because they just are associated with being a teenager, whether it's because they don't know that it's a sign of depression. Irritability is probably the number one thing I see. And I think this is often overlooked because teens are irritable towards their parents. I know I was irritable
Yeah.
towards my parents. And a lot of times people think of depression as really like isolating, withdrawing, which I'll get to here in a minute, crying. They don't think of like outward expressions of irritability. So if you're noticing your teen is like really irritable, like more than usual, pretty much all the time, little things tend to trigger them a lot more. I would definitely check in. And once again, it doesn't have to be depression. That could be anxiety. It could be substance use. There could be something going on, but irritability tends to be a big sign that there may be a mental health concern going on. Another one I see a lot is sleep changes. And, once again, this is one that's often overlooked because we expect teens to have poor sleep,
Yeah.
right? We expect teens to stay up late, not want to get up on the weekends. So a lot of people really pass this off as It was just my teen being my teen.
Caffeine.
Exactly. But when I'm talking about sleep changes, I'm talking about sleeping very little at night. So, maybe they used to stay up till midnight, but now they're staying up till 2 or 3 AM. Maybe they're complaining it's hard for them to go to sleep. They're still getting up for school, but they're exhausted. Maybe they're falling asleep in class or coming home after school and taking naps for like 4 or 5 hours, which is gonna make them not be able to go to sleep at bed. Opposite end, they're sleeping all day, every day. They're hard to get up for school. On weekends, they're literally sleeping the day away or taking naps and just feel like really fatigued all the time. So, teens typically need 8 to 10 hours of sleep per night. But if you're noticing like way less or way more, I think those are signs that maybe something might be going on. Another sign that I see a lot where people overlook or don't think as much is appetite changes. And so a lot of times with depression, we'll see people either undereat or overeat or a combination of both. So they might say, I'm just not hungry. And now this could be due to like they're experiencing stomach pains because we know that depression can manifest physically as well. A lot of time they might say they don't have like the energy or effort to get up and make something, so they're just not gonna eat because of that. Or on the opposite end, maybe they're eating way more than usual. They're eating their 3 meals, they're eating snacks at night, they're bringing food into their room, eating more like quote unquote comfort food because they're using food as kind of like a coping skill or an emotional crutch. The next thing I would say is loss of interest or pleasure in things that they used to enjoy. So if you start noticing your teen that, say, I don't know, grew up playing basketball their whole life, suddenly is like, I don't want to play anymore, or I have no interest, or it's boring, or maybe they used to really love video games and now they're not playing them anymore, or they used to draw and now they have given that up. So the what we call anhedonia, but like loss of interest and pleasure. And once again, a lot of parents are like, oh, they probably just grew out of it, which could be true. Like a lot of teens grow out of things that they used to enjoy. But if it seems more, once again, abrupt, like that big shift in behavior, or if they're irritable when talking about the thing, like, mom, don't put so much pressure on me to do basketball. I just like hate it now. Like there might be something going on.
Okay.
So, yeah, I'll pause there because I think
No,
that
those are
was
good. Those are good.
5.
No, those are perfect. I was just thinking in my head, I was like, I wonder if there's a difference between how it manifests in teenage boys and teenage girls. Do you notice
Ooh,
differences?
um, yes. So boys both are irritable. Boys tend to be more irritable and angry. They more outwardly express how they're feeling. Girls tend to internalize it more. I will say though, like in recent years, I feel like I'm noticing less of a gender gap than maybe
Good.
I first knew or was taught in grad school. Girls generally tend to be more tearful, or they may still socially hang out with friends where boys will withdraw more. But I think one of the biggest difference is like the outward expression of like anger or irritability compared to girls more internalizing it. I don't know if there's data on like the converging of
Yeah.
it, but that's just been my experience recently. If I think about a lot of the teen boys I've seen, um, a lot of them are more like internalizing or more willing to talk about their feelings, which I like. I think that's a really good
Interesting.
shift. Yeah.
Yeah, things are changing, which is
Yeah.
wonderful because historically it was always just that the girls were much more likely to turn inward, right? And that's
Mhm.
also where you see like a lot of the eating disorders and stuff like
Yes.
that. And then men are and boys are more likely to externalize their anger and how they're feeling. So that's very interesting. And it's hopeful to hear that things are changing a little bit. And you had mentioned earlier, like parents not necessarily knowing like the best way to help. So if
Mhm.
a parent notices any of these 5 signs, you
Mhm.
mentioned talking to them and calling out, like, noticing a change. Are there any other tips that you have for parents for navigating this with their teen?
Yeah,
Well,
absolutely. So I think first approaching the conversation really just with curiosity, and compassion, recognizing that you're probably not going to get everything right, and that's okay. Also, recognizing it might take a few attempts. Like, if your child dismisses you right away, that doesn't mean like everything is okay. Maybe you check in at a later date. When I talk to families just about communication in general, one tip I always give them is if you're going to have a important conversation, make sure you both have undivided attention. Make sure it's a time where neither of you are rushed. Like you don't want to be trying to have this conversation when you're cooking dinner and then, you know, your teen has to be out the door 10 minutes after dinner for whatever it is. So asking like, "Hey, I wanna talk to you about something. Is there a good time that we could sit down and talk?" The other thing I tell parents a lot is just to say, like, "I don't have to be the person
Excuse me.
that you talk to, but would you be willing to talk to someone about this?" And kind of partnering with them. It can be hard because a lot of teens don't wanna go to therapy or maybe resistant to therapy, but I think if you approach it from a standpoint of like, "I wanna get you help. I recognize I might not be the person that you wanna talk to. Can we look for someone together?" And, looking with your teen for a therapist, allowing your teen the autonomy to choose someone that they feel like they would open up to, I think is a really good way to approach it because you're communicating, I see you, I support you, and I recognize that you might not wanna talk to me about these